This is not accurate ha, kasi dapat pare-parehas yan. Okay, so 100, 200, ito yung 200 mo, 3, 4, 5, 6, 7, 8, 9, 1,000. And then, 1,100, 1,200. So, ito yun. So, from here to here, that is your FEF 200 to 1,200 ml. Okay? Yan. So, that is the forced expiratory flow between the first 200 ml and the next 1,000 ml of your volume. Okay? Some books will actually call this one as maximum expiratory flow rate or MEFR. Okay? Yung kanina, MMFR yon. Maximal mid expiratory flow rate. Ito naman, maximal or maximum expiratory flow rate or your MEFR. Sorry, mali pa. Kulang. Okay? Oh, now, this one also is considered as effort dependent. Okay? Why? Kasi kung titingnan mo siya, ito yung first portion of your exhalation apart from your FEV1. Okay? So, ibig sabihin nun, this portion also, your FEF 200 to 1,200 will reflect now your medium to large airways. Okay? Kanina, yung FEF 25 to 75%, that will actually reflect your small airways. Your FEF 200 to 1,200 will reflect naman your medium size to large airways. Okay, so in the examinations, okay, lumalabas din na question yan. In the examinations, if you are asked, what will actually measure now your medium size to large airways, you go for FEF 200 to 1,200. Kaya there are certain interpretations that will tell you na there is obstruction in, or you can see interpretations that tells you small airways obstruction. How do they know that the obstruction is located at these small airways? So they have seen it because the value of your FEF 25 to 75% is actually decreased. If they say naman that there is obstruction in the medium-sized airways, how did they know that that is actually located at the medium-sized airways? So they look at your FEF 200 to 1,200 ml. Okay? So those are the things, important things that you have to remember. Normal value is 6 to 7 liters per second or around 400 liters per minute. Okay? This is your flow volume loop. Okay, eto na yon. Kasi, this is your flow, tapos eto yung volume mo. So, it's a loop. Kanina, graph lang yon. Okay, so makikita mo, baka siguro ito yung common na nakikita nyo. But again, as I've said, you can have both volume time graph and your flow volume loop. Okay? In your flow volume loop, you can actually identify your PEFR and your PIFR. Okay? The peak, tandaan nyo lagi ha, when you are talking about PFT, the upper inflection point will always be your expiration. The lower inflection point, kabaliktaran yan sa inyong neck vent. Kasi in your mechanical ventilation, you also have your graph. May mga loops din kayo sa inyong neck vent, tama? Pero, the upper inflection point, if you are talking about neck vent, the upper inflection point, yung nasa taas nitong line na to, that is inspiration. Yun sa baba, that is your expiration. Kabaliktaran sa PFT. Okay? Kasi, why do I have to tell you this one? Because you might be given some examples in your examinations. Okay? So, pag PFT ang pinag-uusapan natin, the one that is on your upper inflection point is exhalation. Okay? exhalation yan. Dito sa baba, that is your inspiration. Okay? Sa back vent, baliktad. Yung andito sa taas, that is inspiration. Yung dito sa baba, that is your expiration. Okay? Mm. So from here, you can measure now, from here to here, is your forced vital capacity. Okay? Mm. And then, may mga ano doon na may umiikot saan, that is your tidal volume. Okay? So, you instruct the patient again, inhale deep, okay, blow hard. Ito yun, blowing, blow, 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 until 6 seconds. And then, inhale deep, ito yun, inspiration niya after exhalation. Okay? Oh, so from here, definitely, what you see here is the flow, ha? Okay? So, flow yan. Meaning ng flow, gaano kabilis or kabagal. And then, in here, that is the volume. Okay? So, this one, ito yung pag inano natin, this is your volume time graph. So in here, sabi ko nga, mas madaling makita ang inyong FEF 25 to 75% if you are talking about your flow volume loop. Kasi this one, yung gitna, no? That is your FEF to 50%. Okay? Umpisa, that's 25. This is your 75%. So FEF 25 to 75%. Okay? Your FEF 200 to 1,200, since this is the volume, first 200 to the next 1,000. Okay? That is your FEF 200 to 1,200. Okay? Mm. So, PAF is the maximum flow rate during your forced vital capacity. Okay? PIF is the fastest flow rate during maximum inspiratory effort. Ito yon, PIF. Ito yung PEF mo. Normal value for your PEF is 400 to 600 liters per minute. If you're going to use liters per second, it's 6.5 to 10 liters per second. Okay? Oh. Now, let's go back now to your obstructive lung disorders loop. Ano bang itsura ng loop ng obstructive lung disorders? Tandaan nyo, the loop of your obstructive lung disorders will resemble scooping out. Okay? Parang scoop ng ice cream. Okay? So, you see scooping out. If you are talking about obstructive lung disorders, kaya nga makikita nyo ito. Yan. So, parang, di ba, para kang nag-scoop ng ice cream. Okay? Always remember that if you are talking about obstructive lung disorders, okay, the hallmark of your obstructive lung disorders will always be your FEV1, FEV1 over FVC ratio. Or in some books, ito, baka sabi ko, maka-encounter nyo. When you say FEV 1%, parehas lang yan. It is also pertaining to FEV1 over FVC ratio. So if you have encountered FEV 1%, sorry. Yan. If you will encounter FEV percent or FEV 1%, that's all pertaining to FEV1 over FVC ratio. Parehas lang yun. Okay? So, I will repeat. The hallmark of your obstructive lung disorder is FEV1 over FVC ratio or your FEV 1%. Plus, decrease lahat ang inyong flow rates. Plus, increased or normal ang TLC niya. Okay? I will repeat. The hallmark of obstructive lung disorder is a decrease in your FEV1 over FVC ratio. That's the hallmark. Ibig sabihin nun, if you see that the results are actually decreased, FEV1 over FVC ratio is decreased. Ano ang decrease na pinag-uusapan natin? Less than 80%. Okay? Sabi ko kanina, that's the magic number, 80%. Okay? So if it's less than 80%, ang inyong FEV1 over FVC ratio, look at your flow rates. Anong flow rates ang titingnan mo? FEF 25, FEF 200 to 1,200. And they are also decreased. Look at your TLC. If it is increased or normal, then that is obstructive lung disorder. Actually, sa exams, minsan, halos karamihan, I should say, na nilalabas lang nila during examinations are only three parameters. You have your FEV1, FVC, FEV1 over FVC. Yun lang. And then they ask you to interpret. Can you do your interpretation? Yes. You look at your FEV1 over FVC ratio. If it is decreased, automatically that is obstruction. Okay? Because, ulitin ko, FEV1 over FVC ratio is the hallmark of obstruction. Okay? There are also some questions in the examinations wherein they give you pictures of the loops. Okay? And then they ask you to identify kung ano yung sinisignify ng mga yan. Okay? So if you see both, okay, nawala, 'di ba? Normal loop supposed to be is patulis and then ganyan and then that's one. This is your exhalation portion. This is your inhalation portion. Pero anong nawala? Nawala ito, na-erase siya, 'di ba? You can see there is actually flattening. Okay. You see flattening of that one, flattening also of your PIF, I should say. If you see that one, then that is indicative of a fixed airway obstruction. Okay? Pag ganyan ang nakita nyo at ipapa-identify sa inyo, you choose fixed airway obstruction. Dito naman, ano ang nawala? Etong portion na ito, nawala siya, di ba? Dapat pa ganyan yan, pero nag-flatten siya dito. Walang problema dito sa taas. Okay? What is missing is this one. It becomes truncated ang tawag dito, doon sa baba. Okay? Ito ang tawag dyan, both truncated. Ito naman, yung inspiration portion ang truncated. Okay? So ano naman ito? This is your variable extrathoracic obstruction. Okay? Dito sa isa, ano ang nawala? Dito naman sa taas ang nawala. So your expiratory portion is the one that is truncated. Walang problema dito sa inspiratory phase mo. Okay? So if you see that the one that is truncated is actually your expiratory, then that is variable intrathoracic obstruction. Okay? Para di kayo malito, tandaan nyo. What is in is out. What is out is in. Mahirap magsulat. Oh, I will repeat. What is in is out. What is out is in. Bakit ganon? Okay? What is in is out. Ano ang nawala dito? Inspiration, tama? In yun. Saan ang obstruction? Outside. Extrathoracic. Okay? Dito naman, what is out is in. Okay? What is missing here? Expiration, di ba? What is out? Kasi outside. Dito, expiration is in. Bakit? Where is the obstruction? Inside. Intrathoracic. Okay? Maliwanag po. Pag both, walang problema. Kasi you know that that is fixed obstruction. Whether intrathoracic or extrathoracic. Okay po? Yes? Nakuha po? Okay. Akala ko tinulugan niyo na ako, eh. Do I still have some, students?
Yes, ma'am.
Nag-leave na yata
Yes
lahat.
po.
Yes,
Okay.
ma'am.
Yes, ma'am.
Okay. Sige. How about the other classroom? Are you still with me? Ay, wala. Nawala sila. Okay. Konti lang. Nawala na yung iba. Majority, 91 na lang kayo. Anong room ito? 91 na lang sila dito sa room na to. The other room, 102. Some are actually leaving. Please do not leave. Okay, please do not leave. This is for you actually. So, paghirapan natin pare-pareho. Okay? So, if your lecturers will actually will also exert effort, no? Dapat ganun din. Sabi ko nga both, it's a work between you yourselves and of course, those who would like to help you. So, if you need to, I hope that the reason why they are leaving is due to some problems with their internet connection at hindi dahil sa napagod na sila or na-bore sila or ganun. Okay? So if you need to relieve yourselves, just go to the bathroom. You don't need to leave the classroom. Balik ka ulit. Okay? But please stay with me hanggang sa matapos tayo hanggang alas 5. Konting oras lang naman. Okay? So, malay mo, nung time na nag-leave ka, may ilang points na akong nasabi doon, di sayang naman yung mga yon, 'di ba? Okay. Okay, nakuha nyo yung tip ko dito so that you will remember at hindi kayo malito. Yes. Sabi ko hindi nawawala itong mga questions na to sa exams. Meron at merong lumalabas na ganito sa exams. Yes? So they will let you identify. They will ask you some. They will have some pictures and then you identify. Okay. Okay. Teka. Bago tayo pumunta sa restriction. Maliwanag ba yung sa obstructive lung disorders? So ano ang titingnan nyo pag sa obstructive lung disorders? Isa-isahin nga natin. What are the things that you need to look for if you are contemplating on an obstructive lung disorder? One is, what is the hallmark of obstruction again?
FEV1 over
Yes.
FVC ratio.
Okay, very good. So FEV1 over FVC ratio. Plus, ano pa?
FEF 25 to, 27, wait lang.
And
55.
Flow rates.
FEV1, FVC ratio.
so, una is you have your FEV1 over FVC ratio, or other books will call it FEV1%. That's one and the same. And then, decrease lahat ito ha. So, decrease ang FEV1 over FVC ratio. Decrease ang inyong flow rates. So, what are the flow rates that we are looking at? Your FEF 25, 75%. FEF 200 to 1,200. Even your PFR. Okay? Flow rate pa rin yun. Peak expiratory flow rate pa rin yun. Plus, either an increase in your TLC or a normal TLC. Okay? Or, pwedeng RV to TLC ratio ang nag-increase. Okay? So, yun yung mga titingnan nyo pagdating sa inyong obstructive lung diseases. Plus, of course, you try to look at the loop. Okay? The loop, the typical loop of an obstructive lung disorder shows scooping out. Okay? So, yan yung kailangan nyong tingnan. Okay? Let's go to your restrictive lung diseases. Okay? Ito naman, what is the description of the loop of your restrictive lung disorder? It resembles a witch hat. Okay, 'di ba? Ito tingnan niyo 'to. 'Di ba parang hat ng isang witch, 'di ba? Patulis. Okay. Plus, what else? All lung volumes and capacities are decreased in your restrictive lung disorder. The hallmark of restriction is FVC. Ulitin ko. Okay? Description of the loop of your RLD or restrictive lung diseases resembles a witch hat. Or it can be, pwede rin naman, na miniature ng normal loop. Okay, kasi parang lumiit lang yung normal. It's normal looking. You do not see scooping out here, but it seems na parang lumiit siya. Okay? Nag-shrink yung inyong loop. Okay? That's a typical loop of your restrictive lung disorders. With regards to the parameters, the hallmark of restriction is FVC. So once you see that the FVC is decreased, automatically that is restriction. All lung volumes and capacities are decreased, restriction yan. And then, how about your FEV1 over FVC ratio? It can be normal or increased. Okay? So that is, kaya nga sabi ko, pag FEV1 over FVC, ang nag-decrease, automatic obstruction yan. Pag FVC ang nag-decrease, automatic restriction yan. How about your FEV1? Okay? Kasi sabi ko, in the examinations, usually, they can only give you 3 parameters. FVC, FEV1, FEV1 over FVC ratio. How about your FEV1? Okay? Your FEV1 for both restriction and obstruction will be decreased. But the pathology behind the reason why your FEV1 will be decreased in both diseases will actually be different. Anong ibig sabihin nun? Both restriction and obstruction will show a decreased FEV1 result. Okay? Whether restriction or obstruction yan. Kaya do not ever use FEV1 as your basis for your interpretation. Because whether it is RLD or OLD, that will actually be decreased. Why is that so? Magkaiba lang yung rason kung bakit sila nagdi-decrease. What is the pathology in your obstructive lung disorder? Why will you have now a decrease in your FEV1? The reason why you have a decrease in your FEV1 in your obstructive lung diseases is due to obstruction. Isipin mo, dito sa airways mo, there is obstruction. Okay? Either lumiit yung daanan ng hangin because of an obstruction, okay? So you can have inflammation in the airways. You can have obstruction because of secretions. So when the patient will exhale, di ba? Sabi natin, FEV1 is forced expiratory volume in 1 second. So the patient will exhale forcefully yung amount na lumalabas during the first second of your exhalation, that is your FEV1. Because of the obstruction in the airways, babagsak yung inyong FEV1. Okay? That's the reason why the value for your FEV1 in your OLD will actually be decreased. What about in your restrictive lung diseases? Why will it actually decrease? The value in your FEV1 will decrease in your restrictive lung disorders. It's because of when you inhale, kasi nga meron kang restriction. What is the problem here? Okay? There is either restricting the lungs to expand, or the thoracic cage is also restricting the lungs to expand. So may pumipigil. Okay? So ngayon, when the patient will maximally inhale and then will exhale maximally, kung ano yung pinasok mo, yun din yung ilalabas mo. You cannot exhale something that you did not inhale. Logical, tama? Kung konti lang yung nilabas mo in your vital capacity, the volume that you will exhale in your FEV1 will also be decreased. Nakuha yung lohi ko? Kasi nga, konti yung pinasok mong hangin. So, kung mag-e-exhale ka, the volume that you will exhale in 1 second will also be decreased kasi mababa yung vital capacity mo. So, kung lalabas itong hangin na to, konti lang din yung mailalabas mong hangin. That's the reason why your FEV1 will actually be decreased. Kuha? Okay. So, that is actually the reason why you have a decreased FEV1 in your restrictive lung diseases. Okay? Okay. These are all examples of different loops still. Okay, so normal looking loop, emphysema, so see, it's very obvious yung scooping out nila, 'di ba? Ito naman, obstruction. So anong nawala? Ito. Okay, you have truncation in your expiratory. Saan yan? Main stem bronchial obstruction ang tawag dyan. 'Di ba? Extrathoracic. Ito, both are actually truncated. So, fixed upper airway obstruction. Ito, mas malala. Okay? Mas pronounced yung nawala dito sa baba as compared dito. Okay? So, extrathoracic, again, upper airway obstruction. Ito naman sa taas, intrathoracic. So, again, sabi ko, tandaan nyo, what is in is out. What is out is in. Ito naman, normal looking pero miniature. Tama? Lumiit siya. Parang nag-shrink lang yung normal loop natin. So, restriction yan. Restrictive lung disease. Ito naman, oval. Okay? Looks like an oval. It looks like an egg. So, that will resemble neuromuscular weakness or neuromuscular disorder. Okay? Questions? May tanong? Wala. Okay. So, there are also acceptability criteria. Okay? My criteria there for you to accept the test. Okay. What are these what are these acceptability criteria that you need to fulfill? Okay. So in your lung volume capacities, you have acceptability criteria. In your FVC, you still have your acceptability criteria. Okay. So first is there is no excessive subject hesitation. Okay, how will you know that there is no subject hesitation? You look at your back extrapolated volume. Okay, your back extrapolated volume should not exceed 5% of the FVC or 0.15 liters, whichever is greater. Ibig sabihin nun, ano ba yung back extrapolated volume? Ilabas natin si volume time graph. Okay? Yan. So when you say back extrapolated volume, this is your steep curve. Ito yung mini-measure natin. Okay, back extrapolated volume. That is the exhaled gas during your exhalation, before you have your forceful exhalation, I should say. So kung nag-hesitate si pasyente sa pag-exhale during your first exhalation, makikita mo masyadong malaki ito. This one is what you call as your back extrapolated volume. You will see that it exceeds now 5% of your FVC, or the value is 150 ml. Kung i-convert natin ito, kasi paano mo i-measure yun? 2.5. So, para mas madali, 150 ml. Okay? So if the value of your back extrapolated volume is more than 150, ibig sabihin nun, you should not accept the test. Kasi it did not fulfill already your expiratory effort, which is supposed to be forceful and fast. So nag-hesitate si pasyente because what is your proof? Your back extrapolated volume is too high. Okay? But what else? There should be no artifacts. Okay? What are the common artifacts na makikita mo? Coughing. Sabi ko nga, if this is your flow volume loop, no? Makikita mo, pag nag-cough yung pasyente, exhale, tapos blow, 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 blow. Merong sort of appearance. That is coughing. Okay. No Valsalva maneuver. Ano ibig sabihin ng Valsalva maneuver? Anybody? What's Valsalva maneuver? Ito yung pag constipated ka, 'di ba? So what you are doing while you are constipated is what you call as Valsalva maneuver. So ibig sabihin nun, you forcefully exhale against sorry. You forcefully exhale against your closed glottis. Okay? So madali lang siya. Sabi ko nga, kung nag-constipate kayo, tapos force mo yung sarili mo, gaganon ka, mag-e-effort ka, that is Valsalva maneuver. Okay? So once you see that the patient is having Valsalva maneuver, you have to reject the test. There is no variable effort. So again, what is the common loop when there is subject hesitation? Okay, pag nag-hesitate yung pasyente, I mean variable effort I should say, okay, nag-exhale siya, tapos binawi niya ulit, pinigilan niya, exhale siya ulit. Okay, pwedeng ganyan yung itsura ng ano mo or another ganyan. Okay, so that is variable effort. What else? No volume loss because of your system leak. What is the itsura naman? If this is your exhalation portion, blow, bigla siyang nagkagan ganyan. Okay, supposed to be smooth flowing yan, tapos hanggang gaganon siya. Pero kung biglang naputol, that is system leak. O kaya, ganyan yung itsura niya, instead of exhalation, and then blow, tapos ganyan, diretso. Tapos inhale deep, wala yung ganito niya. So that is an example of your system leak. Okay? Obstruction in the mouthpiece. Okay, sabi ko, common causes of obstruction is actually your dentures or the tongue. Okay? So you instruct your patient, place the tongue under the mouthpiece. Tapos tanggalin yung mga dentures. Okay? No premature termination of the test. How do you know there is premature termination of the test? Hindi niya na-achieve yung 6 seconds. Supposed to be, you let the patient exhale, blow, to a 6-second period. Pero kung bigla siyang nag-blow, tapos, pinigilan niya, okay, sudden drop, okay? That can mean either premature termination of the test, o kaya, sa volume time graph mo, no? Imbis na gagaganyan, stiff, and then blow, and then magpatuto siya. Dapat, kung biglang nagganyan, tapos wala nang katuloy na wala itong portion na to, early termination of the test yon. Okay? Now, in your volume time graph, paano po kung talagang wala na talagang ma-exhale? Kaso hindi pa siya umabot ng 6 seconds. So you just let your patient open their mouth. Okay? Until such time na natapos na yung 6 seconds. Okay? Oo. Para hindi siya early termination. Okay? During naman the end expiratory effort, check mo. No expiratory test maneuver performed for less than 6 seconds. Unless, as I've said, the volume plateau is present. How will you know that there is, saan ba yung volume plateau na pinag-uusapan natin? Okay, ibalik ko lang yung volume time graph kanina, ha? para makita natin yung volume plateau. Okay. See this one, diba? Dire-diretso yan, and then mag-flatten siya. Sorry, dapat straight yan na flat. Okay, papataas ako. Yan. Flatten. Yan. So that, if you see this one, there is plateau. Okay? This is what you call as volume plateau. Even if the patient did not fulfill, ito yung 6 seconds mo kasi. So kung dito, nag-plateau na siya, okay, papaganyan, even if you did not reach 6 seconds, you can already ask the patient to inhale. Okay, pwede na siyang mag-inhale ulit. Okay? That is what you mean by your volume plateau. Okay? So once you see these ones, these are your acceptability criteria. Again, as I said, tandaan nyo itong mga to dahil ito yung common na tinatanong sa exams. Okay? So, no subject hesitation, no back extrapolated volume exceeding 5% or 150 ml, whichever is greater. Okay? No artifacts like coughing, Valsalva maneuver, variable effort, volume loss, obstruction, or early termination of the test. Okay, what else? No expiratory test maneuver for less than 6 seconds. Ibig sabihin nun, ang magic word is, or ang magic time is 6 seconds. Okay? Less than 6 seconds, that is early termination. Unless, may premise, unless you see already volume plateau. Okay? Criteria for reproducibility naman. Sabi natin, reproducible or repeatable. Okay? So, reproducibility criteria, the two largest FVC values are within 200 ml. So again, as I've said, you get the largest FVC, second largest FVC, you get the difference. The difference is within ha, not more than. Within 0.2 liters or within 200 ml, that is good. Two largest FEV1 value, okay, again, largest FEV1, second largest FEV1, you get the difference. It has to be within 200 ml again. Okay, if that's check, okay, so it is reproducible. Okay, ibig sabihin nun, repeatable yan. Okay, if both of these criteria are not met, then you continue testing until both criteria are met. Okay, total of 8 tests. So sabi ko kanina, 8 tests is maximum. And then patient cannot perform or cannot continue. Okay. Among the tests that you have, you select the best 3 maneuvers. And yan yung i-enter mo na trial 1, trial 2, trial 3. From the 3 trials that you have chosen, you have to choose the best test. Ito, tandaan nyo. The best test should reflect the highest value for your FVC and the highest value for your FEV1, even if they come from 2 different tests. Ulitin ko. The best test that you will report or that you will choose from among the 3 trials, or 2 trials man kung 2 trials ang ginawa mo, because you have already fulfilled reproducibility and acceptability criteria. Okay? So, the best test that you're going to choose or you're going to report will bear or will have the highest value for your FVC and the highest value for your FEV1, even if they will come from 2 different trials. Nakuha? Ano ibig sabihin? Okay. Trial 1, trial 2, trial 3. Okay? And then, you have FEV1, and then FVC. All in liters, ha? So I don't have to put liters. Okay. So yung FEV1 mo, yung FEV1 mo, sa trial 1 is 1.2 liters. Okay. Sa trial 2, it's 1.0 liters. Okay. Sa trial 3, it's 1.1 liters. FVC mo, sa trial 1 is 3.5. Okay. FVC mo sa trial 2 is 3.55. Sorry. 3.55. Okay. 3.55, sorry. Eh, nagsa-stop yung aking, basta 3.55 yan, ha. Trial 3 mo is nasa 3.4. Okay. O, ganyan yung resulta. What is your best test? Anong pipiliin yung best test dyan? Oo. What is your best test there? Trial 1. Others? Other answers? Oh. So sabi ng isa sa inyo, trial 1. How about the rest? So meaning, FEV1 mo, 1.2. FVC mo, 3.5. Kasi yun yung trial 1. Okay. How about the rest? Tama ba yun? That you should
Same
have trial 1 din? So, trial 1. So, if I will give you, saglit ha, alis muna tayo dito. Mag-ano lang ako ng para mas maano natin. Okay. Can you see this one?
Yes, ma'am.
This is your
Yes po, ma'am.
this is your trial 1. Okay. Trial 1. Trial 2. Trial 3. Then, this is your FEV1. Sorry. FVC. Sabi natin kanina. Wala siya. But, you remember the values that I gave you? Trial 1 mo is 1.1. Tama ba? Alright?
1.2, ma'am.
1.2. Okay. Trial 2. Trial is 1.1.
1.0. 0.0, ma'am.
And then trial 3 is 1.1.
1.1.
Okay. FVC mo is 3.5.
3.5.
This one is 3.55. Ito is 3.4. Tama? Tama ba ako? Am I right? These are all in liters, ha? Oo. So this will be your choices. Letter A, ang best test. I'm asking for the best test. Okay. FEV1 is 1.2. FVC is 3.5. Letter B, FEV1 is 1.2. FVC is 3.55. Letter C, FEV1 is 1. This is 3.55. Letter D, FEV1 is 1.1. And FVC is 3.55. What's your choice? Anong sagot dyan? What will you report as the best test? You will have
Letter B.
letter B. May nagsabi letter B. Yung iba ay letter A. Ha? Letter A. Kasi yung trial 1. Yun, trial 1, trial 2, trial 2. How about the rest? Ano kung ito yung na-encounter nyo sa exam? The question is, what is the reported best test? One said letter B. How about the rest? How about the rest? It's letter. Sabi ko, ulitin ko yung sinabi ko kanina. The best test should have the highest FEV1 and the highest FVC. Even if they come from two different trials. Nakuha? So in short, the correct answer is letter B. Bakit letter B? Ano ang highest dito sa FEV1 mo? Diba ito? This is your highest, right? Oh.
Yes,
Ano
ma'am.
naman ang
Yes
highest
po, ma'am.
sa FVC mo? Diba ito?
Trial 2. Yes po.
Yes. So, you will report FEV1 1.2, FVC as 3.55. Okay? Kahit, ma'am, yung isa galing sa trial 1, yung isa galing sa trial 2. Yes. Even if they come from two different trials. Okay? So, you report the highest value for your FEV1 and the highest value for your FVC. Okay? Yes po. Questions? May tanong? Questions? None. Okay, so I hope it's clear. Okay. Next is part of your FVC maneuver. Can you still hear me?
Yes, ma'am.
Yes, ma'am.
I'm still audible.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes po.
Malakas kasi ang ulan. So, another test that you can have for your force for your lung mechanics, pulmonary mechanics is your MVV or your maximum voluntary ventilation. What is your maximum voluntary ventilation? You instruct the patient to breathe as deep and as fast as possible. So, deep and fast breathing. So parang ano din yan ng panting na tinatawag natin. For how long? For 12 to 15 seconds. Okay? Your maximum voluntary ventilation will test for your overall breathing capacity or your overall lung function. Okay? Because this test will clearly measure now the capacity of your breathing muscles and the capacity of your thoracic cage. Since you are measuring now the overall lung function and your ventilatory reserve capacity, binimeasure nito gaano kalakas yung inyong breathing muscles and of course your thoracic cage. Okay? So, you ask the patient, inhale deep and fast for 12 to 15 seconds. So, umpisa, okay, syempre maninibago yan. But once the patient already has the pacing, doon mo na i-record yung test mo. Okay? So, the value that you get is normally, the normal value for your MVV is 170 liters per minute. It will decrease now in your obstructive lung disorder. Okay? Or, what else? If there is poor effort, magdi-decrease yan. Or there is neuromuscular disorders. Those are the instances that your MVV will decrease. So, ibig sabihin nun, sa RL, di ba, normal yung MVV nila? Yes. Okay? Acceptability criteria, may acceptability criteria din ang MVV. What is the acceptability criteria? There should be irregular volume and time tracing. Okay? So, tingnan nyo ito. Okay? So once mo umpisa, hindi pa makuha ng pasyente. Okay? And then, you have the regularity already. So, halos pare-parehas yung inhalation, exhalation, and the pacing of your patient. So that is what we call as regular volume time tracing in the volume and the breathing rate. Okay? There is a constant and expiratory baseline on the volume time graph. Okay? Measured value is at least as large as the volume determined by multiplying now your FEV1 by 45. What do you mean by this one? You get your FEV1. Saan mo nakuha yung FEV1? Doon sa FBC maneuver mo. Okay? And then, you multiply it by 35. The result should be as close as the value of your MVV na nakuha mo. Okay, na na-measure. Okay? So, once you have this one, the value is as large as the volume that you get by multiplying your FEV1 multiplied by 35. You see a constant and expiratory baseline or the regular pacing of your volume and your rate, then you can accept now the test. Okay. Ganun din ba? Same din ba that you have to have at least 3 trials sa MVV? Actually, mahirap gawin yung MVV. So once you see already, kahit isang trial yan, as long as you have fulfilled your acceptability criteria, then it's okay to have one. Kung gusto mo, pwedeng dalawa. Okay? So you have also your reproducibility criteria. Kasi you cannot have your reproducibility criteria kung iisa lang. Kung dalawa yung ginawa mo, ibig sabihin nun, acceptable yung first, acceptable yung second. Next question is it reproducible? So again, the largest and the second largest values are within 10% of its value. So same din lang. You get trial 1, trial 2, get the difference. If they are within 10% or you even trial 3. Okay? So ito yung first large, ito yung the largest mo. Ito yung second largest mo. So, you get the difference. If they are within 10% of each other, then that is reproducible or repeatable. Okay? And then, tandaan mo, the best test is actually the one that will have the largest value. Okay? So kung ang trial 3 has the largest value for your MVV, this is considered as your best test. Okay? As long as, again, as I've said, it has fulfilled the acceptability criteria and the reproducibility criteria. Okay po? Your MVV will decrease once there is, again, as I've said, obstructive lung disorder, neuromuscular disorder, okay, or neuromuscular diseases, okay, and there is poor effort. Okay? Oh, yun yung mga instances wherein you have a decrease in your MVV. Okay? Questions? Wala. May question? Okay. Approximate value for your MVV, again, as I've said, sa males, you have mas malaki sa lalaki. 160 liters per minute. Female, 120 liters per minute. Again, as I said, these values are based on a 20-year-old Caucasian male with average height and average weight. Okay? So again, as I've said, kahit meron tayong binibigay na mga normal values, definitely, that's for the sake of your exam and for the sake of having the normal values. Okay? For you to base it. Now, if you're going to calculate, definitely, it varies based on your age, your height. Okay? And then, of course, your ethnicity. Lagi yun. Okay? Because that's where we base now the calculation. Okay? Oh. Very easy. Just like opening a bag of popcorn. Okay? Interpretation of your test. Okay? Again, as I've said, look at your FBC, FEV1 over FBC ratio. Normal FBC, normal FEV1 over FBC ratio, normal FEV1, that is normal PFT or normal spirometric measurement. Okay? Next, FBC is decreased, FEV1 is decreased, value for your FEV1 over FBC is above 80%. Actually, doon sa ating sa PCCP criteria, bumaba sila ng 70%. In your book sa EGANS is still 80%. So we still follow 80%. Okay? Oh. So FEV1 over FBC ratio mo is above 80%. That is restriction. Okay? FBC is normal. FEV1 is decreased. FEV1 over FBC is less than 80%. Automatically, that is obstructive. Okay? Oh. Tuloy natin. Restrictive ventilatory impairment ang tinitingnan mo kasi mababa yung FVC mo. Okay? So, what is the next step that you have to do? You can either go for your DLCO, okay? Or you have to go for your MVV. Okay? Oh. Na-check natin ang MVV natin. MVV is less than. Okay? Bumaba yung bumaba yung MVV mo. What are the possible scenario? Poor patient effort. It can be a neuromuscular disorder o kaya pwedeng airway lesion. Let's say, for example, MVV is normal or high. Okay? It can mean you go for another test. Ang tawag doon ay static lung volumes. Okay? Oh. Ituloy natin yung obstructive ventilatory impairment. Okay? Ngayon, ito pala. All values, di ba, in practice, all the things, your parameters are all performed post-bronchodilation. Ibig sabihin nun, diba, usually, ang ginagawa natin ngayon is lahat na binibigyan na natin ng bronchodilators. Okay? In the old dictum, usually, kung obstructive yung pattern ng results ng pasyente mo, that's the time that you perform now your bronchodilator tests. Okay? Pero ngayon, hindi na. Lahat na ng mga tinitest natin, hindi na natin inaantay kung restriction yan or obstruction yan. Okay? We all report tests post-bronchodilation studies. Okay? Now, so tanggalin na natin to ha. Because lahat na post-bronchodilation. How will I know that there is a significant reversibility or significant airway reversibility na tinatawag natin? Okay? If you see that there is an increase more than 12% in your FEV1 and po to ha, hindi or, and 200 ml increase in your FVC or FEV1, then you can say that there is a reversible airway disease. Ulitin ko. If you see 12% increase in your FEV1 and 200 ml increase either in your FVC or FEV1, then you can say that there is a reversible airway disease. If you did not see more than 12% increase in your FEV1 and a 200 ml increase in your FVC or FEV1, then you cannot say that there is reversible airway disorder. So, ibig sabihin, or kung hindi man reversible, ang isang ginagamit na term is significant. Okay? Reversibility or a significant change post-bronchodilation. Iisa lang yon. Okay? So, pag wala kang nakitang more than 12% increase in your FEV1 and a 200 ml increase either ha, in your FVC or FEV1, then that is significant reversibility or a significant post-bronchodilation studies. Okay? Pag wala, then it means irreversible. Okay? Ang kanyang airway obstruction. Maliwanag po. Is it clear? Okay. So, summary. Okay, summary. Obstructive disorders, there is decrease in your FEV1 over FVC ratio because that is the hallmark of your obstruction. Plus, airflow limitation. Okay? So, nagdi-decrease yung flow rates mo. Okay? Examples of this one, you have asthma, COPD, cystic fibrosis. In your restrictive disorders, you look at your FVC. Okay? Plus, lung volumes and capacities are also decreased. Okay? What else? What are the examples of your diseases classified under restriction? Fibrosis, scoliosis, obesity, lung resection, neuromuscular diseases. It can also be cystic fibrosis. So, cystic fibrosis can be both restriction and obstruction. Okay? Yan. So, all parameters, if it's obstruction, your FVC can be normal, FEV1 is decreased, FEF 2575 is decreased, FEV1 over FVC is decreased. Your TLC can be normal or decreased. FVC, hallmark is FVC is decreased. FEV1 over FEV1, I should say, is decreased. Flow rates mo are normal or decreased. FEV1 over FVC ratio is normal. TLC or other lung volumes and capacities are all decreased in your restrictive disorders. Paano kung decrease ang FVC decreased ang inyong FEV1 over FVC ratio, then that is what you call as mixed or a combined obstruction and restriction. Okay? Tanong? May question po? Okay. So this one is for the next one. We'll go to the LCO next meeting. So if you have some questions, later on, pag matapos natin lahat, magbibigay ako ng mga examples and then you try to identify. Okay? So we will reserve the next lesson for our next meeting. I think ang next meeting natin will be Monday. Okay? So I hope na you encourage your classmates to join. And please, kanina nasa 100 class yung isang 120 yung isang classroom, 130 yung isang classroom. Ngayon, ang naiwan na lang ay 87 na lang yung isang classroom ay 90. So, ibig sabihin nun, ang daming nagli-leave. So again, as I said, I hope that the reason why you are leaving is not because you're not interested in the topic, but some problems with your internet connection. Okay. May mga iba working na ba sa inyo? Do I have some working students here? Meaning employed na, or you're all fresh graduates? Just raise your hands if you are working already.